Hello, my colleagues, who are a little bit of everything to every child in every class. The pandemic has brought so many issues into sharper focus in our lives. Some things that might not be new have had to be re-examined because they've shifted their position and have either become less important or more important. One of these is the topic of grief and death. Children are having to confront the loss of their family members and friends, or the fear of dying themselves. As teachers, we often find that we are the people to whom children turn when they need answers, because especially younger children see us as having all of the answers. The way in which we help children to understand and to cope with their grief is obviously very important. But few of us have had any practical training in the area and usually have to rely on our own intuitive responses to the children. Some of us might even find talking about death very difficult. But when there is a global pandemic and death has taken a seat in the chair right next to us, we have to know how to talk about dying, death, and grief in ways that can offer support and guidance to the children and young people in our care. Perhaps the most important thing that we should know is that we should not allow our discomfort to make us silent. When a teacher does not talk about an issue, it can mean two things. Either we don't know about it, or we don't care enough to mention it. Both of these send very inaccurate messages to children. We have to learn to use the right vocabulary. We have to use words like death and dying rather than passed away or gone to a better place. Depending on the developmental stage, children interpret these words very differently. My cousin told me yesterday that a preschooler in her class had been told that her father had gone to heaven. All the child was concerned about was that her dad had left his car keys and his cell phone behind. We have to listen to what the child is saying. Give them the opportunities to talk and express themselves, and sometimes to repeat themselves. We need to be patient and kind, and we need to answer questions as simply and honestly as possible. At the same time, we need to be aware of the cultural differences that exist around the notion of dying, and sometimes even these differences can be discussed. We need to reassure younger children that they're not going to be the next person to die, and that death is a natural part of life. Some children become afraid that one death could signify the deaths of themselves or of others who are close to them. We need to be aware of any major changes in behavior that might be exhibited in the classroom. Grief can be expressed in a number of ways and may include violent outbursts, antisocial behavior, sleeping disorders, or phobias. One of the most important things that we should acknowledge is that we are not trained psychologists and that children may need more help than we can give them. We should not be afraid of suggesting this to the school principal or to the significant caregivers in the child's life. In fact, if we unknowingly do or say the wrong thing, we could be causing more harm than good. We should avoid imposing what we believe on children. This could cause confusion and doubt, especially if it contradicts the family's philosophy. We should also try to avoid the share and compare routine. Saying something like, "My father has also died, I know how you feel," is not helpful to a grieving child, or in fact to anyone who is grieving. We don't know how they feel. We only know how we felt. Grief is experienced differently by everyone. It's much better to ask a child, "Can you tell me how you're feeling?" We can even ask a child to share a memory of the deceased person with us, or to say what it was about that person that was important to them. Essentially, we need to be supportive and to listen to what the child is telling us. Involving the peer group in a discussion can also help, because there may be children in the class who begin to fear their own deaths or the deaths of the people who are closest to them. Share accurate information and be as brief as possible. answer questions honestly, and use appropriate language. We might have to answer the same question over and over again, and we need to be patient and kind with each answer so that the children are given time to think and work through things and don't choose to be silent. Although we should be tolerant, we should try to maintain the normal routines of our classrooms because these in themselves can be helpful to the grieving child. At the same time, we might consider providing opportunities for non-verbal communication, like drawing and dancing or working with a 3D art material. We need to remember that grief is different for everyone and that there is no time limit. Even after the child appears to have settled back into familiar routines, be aware that checking in every now and again is not intrusive, but is rather an act of empathy and true support. This is the time when our pastoral roles become important. Along with all of the other things that are expected of us, we need to be the one person at this time in a child's life who can be trusted to give support and guidance. We need to be trustworthy and honest, and we need to be whole when we enter this space with a child. I wish you strength and wisdom, my colleagues, because we're all going to need these things. It's at times like this that we make that difference. Take care and stay safe. I'll see you again.